Thank you, Madam Chair. I'm glad that we're here today to discuss legislation that will hopefully allow us to stem the overdose epidemic that has taken far too many lives too soon. I want to thank all of our witnesses today for your testimony. In Los Angeles County and across the country, we are seeing an unprecedented humanitarian crisis of people experiencing homelessness that requires a compassionate, thoughtful public health response. According to the Los Angeles County Department of Public Health, between 2017 and 19, people experiencing homelessness in LA County were more than 36 times more likely to die of a drug overdose compared to the general LA County population. Drug overdose deaths involving fentanyl tripled between 2018 and 2020, and drug overdose remains the primary cause of death for people experiencing homelessness in LA County. Comprehensive drug policy aimed at reducing harm caused by fentanyl-related substances must include an integrated public health approach and investments in infrastructure that addresses upstream social determinants of health. This question is for Mr. Chester. Can you discuss strategies the Office of National Drug Control Policy are working on to tackle social factors like homelessness that exacerbate illicit fentanyl-related substance overdoses among the more than 500,000 people experiencing homelessness in our country?
Yes, thank you, Congresswoman, for that question. I think you've brought up a very important point. The first thing I'd like to say is that evidence-based prevention and prevention strategies are a key part of the first-year priorities that the office has laid out for the Biden-Harris administration when it comes to drug policy. The second thing I'll tell you is that the social determinants of drug use are an important part of our academic understanding of what it is that leads to the initiation of drug use in the first place. And that is one of the key areas that the office will be working on in the coming year in order to reduce overall drug use around the country. And as we say, and we've talked about it several times today, there is absolutely a direct linkage among the fentanyl-related substances that are available in our communities, their trafficking, and their use in our communities, and therefore overdose deaths. You can't pull one of those strands apart. You need to be able to deal with it in a comprehensive and a holistic fashion, and that's the approach that we've taken.
Thank you. Dr. Volko, in Los Angeles County, there was a 52% increase in accidental drug overdose deaths and a 136.4% increase in the number of fentanyl-related death rates during the first 10 months of the pandemic compared to the same period in 2019. This alarming uptick of deaths is disproportionately affecting people of color. How can improving research with fentanyl-related substances help us address the opioid overdose crisis and combat drug overdose deaths within highly populated urban areas, particularly among people of color?
First of all, I think that, and we resonate completely with you about the question about the social determinants of health, because they do pertain very much about why you are seeing such a dramatic increase in overdose mortality during the COVID pandemic, and why it's affecting some populations that were vulnerable to start with more than others. Understanding the processes and the challenges that people that are homeless, for example, is crucial for providing solutions. Without it, people that don't have a place to sleep cannot sustain treatment, nor can they actually, when they go to shelters, get exposed to others taking drugs. So understanding the social and cultural factors that have been exacerbated during the pandemic, including the uncertainties and the social isolation, is crucial for containing the epidemic that we are seeing. In terms of how the fentanyl research can help us basically be better able to do a treatment and prevention is, first of all, we need to understand what are the characteristics of the use of these substances, who is using them, how they are combining them. We need to also understand actually how to optimally, as I mentioned before, reverse them, because naloxone is not effective in all of the reversals. And third, how do we optimally not just initiate people on treatment for their opioid use disorder, but retain them on treatment so they can recover and we can prevent an overdose. That requires that we work with, that researchers get their hands on working with fentanyl. so that they can develop animal models, they can actually develop new products, new ways of testing it, new ways of being able to document where people are dying from what, so you can test rapidly right away, as opposed to waiting months. So these are just some of the examples.
Thank you so much, Doctor. I'm out of time. With that, I yield back.